Hello, good morning, everyone. Apologies for the slight delay. We had a few technical difficulties. Good morning to everyone. I'm delighted to be speaking to you all this morning. I'm James Sanderson. I'm Director of NHS Personalised Care for NHS England and Improvement, and I'm also the Chief Executive of the National Academy for Social Prescribing. So I'm going to spend about 15 minutes just talking to you about personalised care, social prescribing, and why, from my perspective, I think that this is a revolution in healthcare. So one of the most powerful tools that we have in healthcare is conversation. But actually, conversation as an opportunity to open up discussion with individuals, to find out what matters to them, to really talk to them about their health and care needs is something that we don't tend to use as much as we should. 40% of people say they're not as involved in health conversations as they would like to be. They're not as involved in decisions that affect some of the most sensitive personal aspects of their lives as they would like to be. 40% of people with long-term conditions also say that they lack the skills, knowledge and confidence to manage their health in a way that best supports them. And 40% of people say that they don't understand the health information that they're provided with. So this presents a bit of a problem, doesn't it? And actually, we have a way of fixing that. And that is to provide people with personalised care. So for me, personalised care means giving people choice and control over the way their care is planned and delivered, based on what matters to them, and building on the assets that they bring to their own care, because we're all experts in ourselves. Healthcare professionals will always be experts in conditions and diseases, but people are experts with their own lives. So how can we create these circumstances where we give people choice and control? Well, that all comes back to the powerful tool of conversation. Asking people in clinical practice what matters to them, not just focusing on what's wrong with them, drawing out the very things that are going to help motivate and support them to gain the health outcomes that they're seeking is incredibly important. And we've invested very, very heavily with this in the health sector. Personalised care was cited as one of the 5 key shifts for the long-term plan for the NHS last year. And we've set out a number of goals to make personalised care universal across the system. Last year, we published Universal Personalised Care, which had 21 actions for the health service that could truly bring unique and innovative ways to support people tapping into the assets that they're bringing to the healthcare system. So we do this by way of our comprehensive model for personalised care. The comprehensive model has 6 key components. It starts with shared decision making, the change in a clinical conversation, that what matters to you question being really, really important. But actually, sharing decisions is something that we don't always do. We need to have better conversations. We need to change that clinical conversation to one that is on an equal with the individual. We need to give them the knowledge that they need in order to make an informed decision. And we know that when people change the conversation, when we use certain techniques, we can reduce costly and risky treatments by about 20% just by changing that clinical conversation. We also need to give people choice, and a really effective choice, making sure that they have all of the options available to them on which to make that informed decision. And then we move into the third area of the model, which is personalised care and support plan. For people living with long-term conditions, it's really vital that we put in place a very, very comprehensive support plan for them that enables them to understand how the various aspects of their care are going to fit together, and enables the health service to understand, what's going to work for them and what isn't going to work for them. These planning tools may sound really, really simple, but at the moment, we know that not everybody has a personalised care and support plan. And actually, some of the way in which we deliver healthcare is quite siloed. We assume that somebody has cancer on a Tuesday and mental health issues on a Wednesday, not that their life is, of course, complex on every day of the week. So a holistic personalised care and support plan will look across the full spectrum of their needs. Then after we've started this model, we need to have different ways of providing support to people. So we're investing a lot in providing self-management support, health coaching, peer support, giving people the access to structured education to best understand the condition that they're living with. If somebody's newly diagnosed with type 2 diabetes, then why aren't we sending them on a course if they want to find out more about their diabetes so that they can learn and become expert in how to manage that condition? Why aren't we connecting people more rapidly with peers that are living with the same condition? If somebody's been diagnosed with multiple sclerosis, why don't we connect them with a peer that's perhaps been living with that condition for a number of years, so that people can gain that support from somebody with that lived experience of the condition alongside the support from clinical experts in the condition. We've also invested heavily in personal health budgets, giving people full choice and control by having the ability to design their care packages with money from the NHS. It's not a simple free-for-all, it's within a structured environment, but for a lot of people being provided with services directly through the NHS and social care, the lack of control is quite challenging for them. So take the example of Robin, who is a member of our strategic co-production group. She has various needs following a riding accident many years ago. And she was actually having, on average, 38 carers a year provided to her by the system to provide really sensitive, intimate care, personalised care in the home. But actually, you know, the care wasn't working for her. On any given day, she'd have a stranger sometimes turn up at her door to provide care. So through a personal health budget, she's been enabled to have the money that care was costing in order to structure her own care packages. So she's employed a team of 5 people that have been consistent for the last few years, and they've got to know her. She's employed people that share the same choices in life and share her hobbies and her music tastes. And consequently, that provides a much better environment for both the carer and for her. And they're cheaper. So we've found across the 90,000 personal health budgets that we've put in place, they are 19% cheaper than delivering conventional services, but achieve an 89% satisfaction rate by the people that are using them. So fantastic opportunity by giving people that full choice and control. And then what I wanted to spend the next 5 or 6 minutes talking about is social prescribing. So the 6th element in the model of social prescribing. Social prescribing has been described as the 3rd revolution in healthcare. If you consider that the first revolution was running water, sanitation, the second, our sort of modern medicine movement with our modern drugs and surgical procedures. Social prescribing takes us back to an opportunity to connect people with their community, to connect them to support that is non-medicalised, creating the opportunities to provide support for people closer to their homes, close to their families, and in a way that best suits them. So social prescribing has been rapidly growing over the last few years, but actually a number of GPs in the country have practiced versions of social prescribing for about 30 years. Sam Etherington in Bromley by Bow, Michael Dixon in Columpton in Devon have been providing a version of social prescribing to their patients for probably 30 plus years. But recently we've been recognising that actually social prescribing could have a huge impact if we rolled it out across the country. So last year we put into the GP contract the requirement for every primary care network across the country to have a social prescribing link worker. And we're in the process of employing up to 4,500 link workers that will sit within primary care to deliver social prescribing universally across the country. So this is a major shift in the way in which the NHS will work. Within primary care, for the first time, there'll be somebody who's dedicated to finding a non-medical solution for an individual, dedicated to creating a connection for that individual across the community within which they live. And the reason for this is that at least 1 in 5 GP appointments now are purely for a non-medical need. People are going to see their GP, are reaching out for support from their GP for issues such as debt and relationships, loneliness, social isolation, and consequently, we need to find a better way to support those individuals. In addition to those 1 in 5 people, a further sort of 1 in 5 or as many as 2 in 5 would benefit from non-medical solutions alongside biomedical interventions. So, for example, somebody with arthritis may be receiving various therapies, various drug treatments, but actually swimming has proven to be very effective for arthritis. So alongside purely supporting people with a non-medical need, social prescribing also provides support for those perhaps with a medical need, but that could benefit from a social intervention as well. So we are rapidly scaling up social prescribing at the moment. We went from 300 link workers to 1,300 now within the last year. And as I say, we're moving rapidly towards 4,500 link workers over the next few years. And this is part of the government's manifesto commitment to have 26,000 new roles in primary care. So primary care is rapidly changing. The 26,000 new roles are going to be made up not just of the 4,500 link workers, but also care navigators to help those individuals navigate the system between their appointments and between their various conditions, health coaches to build the skills, knowledge and confidence that people need to live their lives independently, and also pharmacists, first contact physiotherapists and community paramedics, people that can provide expertise to individuals alongside the support that's provided by general practitioners. And social prescribing link workers are going to work within this multidisciplinary team. This is a massive investment. The NHS is going to be investing about £450 million in these new roles. And we're the first health economy in the world to be investing in social activity as part of the health service in this way. And it works. It works for people. It works because it starts back with what I said at the beginning, with that conversation about what matters to individuals. And what we're finding is social prescribing is benefiting people across 4 key zones of activity. So first one is arts and culture, linking people to opportunities in the community to take part in arts activities. So for example, dancing for falls prevention, frailty, to strengthen core strength, to enable people to move better. Singing for the brain, dementia choirs across the country that are giving people with dementia, various forms of dementia, vascular dementia, Alzheimer's, the ability to connect with individuals, but also to sing and enjoy music. And the English National Opera have just launched, as part of their COVID recovery support plan, a programme called Project Breathe, which is putting professional singing teachers in front of individuals who've had COVID-19 and are using then singing techniques to recover and improve their lung health. So great opportunities in arts and cultural space. The second area is the natural environment. We're going to be encouraging people to get out and about in nature. The benefits of being part of nature, whether that's green spaces, whether that's blue spaces, are proven quite widely now. And we want to encourage people to get out and about, not just the physical exercise, but the mental health support that being out and about is going to provide people. The third area is physical exercise and sport and leisure. Walking football has proven to be a fantastic opportunity. I was at West Ham Football Club at the beginning of this year before coronavirus hit, and visiting their walking football group, which is supporting people that are looking to lose weight, looking to help themselves with their mental health and well-being, and great community initiatives like that across the country. And then the final area is advice, guidance, support, information. So the opportunity to link people from primary care with advice about housing or relationships or legal issues or getting a job, the things that create those pressures in life that can really impact on individuals' health and well-being. So social prescribing represents a massive opportunity. I think it is a revolution in healthcare. The Secretary of State, Matt Hancock, formed the National Academy of Social Prescribing last year that I'm now heading up, to ensure that we can really boost the opportunities for social prescribing across the country. And we've got bold ambitions to work very rapidly over the next few years to create vibrant community packages across the country, alongside the network of link workers that will exist in primary care, to provide people a truly revolutionised way of delivering health and wellbeing. Thank you very much. I hope that gives you an insight into some of the things that we're doing, and I hope that many of you will look towards a career that supports personalised care or social prescribing, or will look into the massive opportunities that there are of training in the techniques that will deliver personalised care into clinical practice across the country. I hope that this gives you a bit of an insight. If you wish to have more information, please follow me at James C. Sanderson on Twitter, also at Pers Care, which is the NHS site for everything personalised care, and at NASP Tweets for the National Academy. Thank you ever so much.